It's sort of intimidating a bit. She's not only an MD, but I think she's either has or is getting a PhD. She's working at the World Health Organization. She's a medical doctor from the Netherlands, and she has been involved in all sorts of things at the UN, and from attended the COP 25, 26, and the first ever UN Youth Climate Summit to advocate for health. She's published all over the place. She also represents 1.3 million medical students at the World Health Organization and works to ensure the meaningful management of youth voices at the highest level of global health and decision making. She will be talking today on climate change and health. And I will shut up and let Iris speak her piece on where we are. And if you will tolerate it, we would like to have some questions at the end for you. All right, thank you for being here. It's a real honor to have you present.
Wonderful. Well, thank you so much for the very kind introduction. And it's my honor to be present in these sessions. You've explained over email a bit what it's like, and it sounds to me like an incredible setup. So I'm super honored to be speaking with all of you today about this topic that that's very close to my heart, that I find very important, as well as the role that I see for young people, and I think all of you as well, in the context of this class and broader, in these challenges that we are facing. So I won't stop too much, and I will dive into the content of the presentation. But I am very happy to be here. So thank you once again for the invite. So I'll talk today about the relationship between climate change and health. And the reason that I'm very motivated to work in this area is, at first, I sort of got into it because of the big impact climate change is having and is expected to have on our health. And I found out after, I think, my first year of medicine, I was first introduced to that concept, and I was kind of blown away and shocked by it. That's kind of how I first got into this area and space. But the reason that I continue to be interested in it is because of the opportunities that it shows. I think health can be an argument for ambitious climate action in every single sector. And I hope that today's session will also inspire you a bit of how you can use the health narrative or the health lens, looking at climate change, to inspire and push for action as well. So I was already kindly introduced, so I won't take too much of your time in that. I hope you can see my slides well, by the way. Let me know if there's any issues there. And indeed, I don't have my PhD yet. I'm currently doing a PhD in London, where I focus on how health systems can transition to become more environmentally sustainable, while also considering how to adapt to the impacts of climate change. And yeah, one other thing to highlight is that you reminded me, Mother, that I have to update my bio. I think that's somewhere on the website somewhere, because I used to indeed represent medical students worldwide to the World Health Organization between 2020 and 2022. In that position, I helped set up the WHO Youth Council, which is meant to be, which is now a new mechanism to really systemically ensure that the voices of young people are heard in the World Health Organization and are contributing to global health governance and decision-making on the global stage. And as of this year, I got hired by the WHO to continue to support those efforts. So the WHO Youth Council and youth engagement in a broader sense, also specifically in the context of climate change, which is one of the priorities of the current WHO Youth Council as well. And so yeah, but basically what I'm doing right now is I'm doing my PhD and I part-time work for the WHO. So that's a bit of my background. So actually, I would like to start out with a question to you all, which I hope logistically is possible. I think we have people online and we have people in the room, as far as I understand. And my question to you is, do you know how climate change is impacting health Have you experienced it, seen it, heard about it? Does anyone have any idea of the relationship and how climate change impacts health? You can raise your hand on Zoom, or otherwise I will turn to the room if there's any there. But I see Farhad on Zoom already has his hand. Please go ahead.
One way to answer that question might also be in the chat box. That might
Yeah.
work.
Yeah, I see Carly already did. Climate change can cause disaster events. Yeah, definitely. Farhad?
Yes, good afternoon. In one conference, we had a doctor that he presented about the impacts of the climate change on the skin, because it has many effects on the skins of the people and some cancers and other effects that I had saw in the health problems about the skin.
Yeah, definitely. A
Thank you.
very important point regarding skin, especially in those areas where there's increased or higher exposure to UV, which can cause issues also on skin um, because of air pollution, which is connected to climate change or other ways of pollution. We also see an increase of issues that are related to the skin, such as allergies as well. Definitely, really good point. Does anyone else have any contributions? See, there's something else in the chat. Carly added to that. Or more specifically, worsen the severity of those disaster events and therefore the health impact. Yeah, I think you're making a really good point. Climate change is connected to many types of disaster events, including extreme weather, for example, and so on. So that's a really important one, definitely. Let me just check one moment to see if anyone else would like to add any thoughts here.
That muted it if you push down.
Oh, more in the chat. Ella says the environment people grow up in can cause health issues like autoimmune diseases, or at least raise the chances. Yeah, there's a lot about the environment and also pollution in our environment that can interact with our health as well. So that's definitely something to consider, certainly. Yeah. All right. I'm just double checking. I hope everything logistically is still going okay. So I think I'll continue on. And thank you so much for all of those issues. So just to give a bit of an idea, actually in 2015 already, the World Health Organization noted that climate change is in fact the greatest global public health threat of this century, and that keeping temperature rise below 1.5 is essential to protect health and restore nature. And the Lancet underlined this as well, an academic journal, by stating the same. And they also noted that health can be the biggest opportunity for climate action, which is what I'm going to refer to in a bit as well. So climate change is definitely expected to impact health in a multitude of ways. And I'll show you a bit of slides as to how. But on the other hand, climate change, we have to also realize that climate change is already impacting health. So you mentioned a lot of different ways in which climate change is connected to health. So thank you so much for all that input. And I can just add some other insights to that as well. So you can divide the impact of climate change on health into two big buckets. On the one hand, we have direct impact. On the other hand, we have indirect impact. So if we start with the direct impact, we've heard you mention some of those. So we've heard, for example, the increase of sunlight or heat or pollution can have on the skin. We've heard about autoimmune diseases. We have heard extreme weather. Extreme weather can also have direct effects on someone. It can cause trauma, for example, on the body, and in that way have many different direct effects on the human health. There are also many indirect effects, and this bucket is much larger and something very important to consider, which is, for example, if we're talking about the impact of sunlight on skin, or we're talking more generally about the impact of heat on human health, or extreme cold, extreme weather. There's a very direct linkage there. However, all of the changes in, for example, weather can also impact other systems on which our health depends. So one example of that is food. Our food systems are expected and are currently already being impacted by climate change. So issues with our food systems, and especially in vulnerable areas, can cause a decrease in people having access to good nutrition, for example. Other examples are that extreme weather, in a sense, can also cause indirect effects, for example, due to mental trauma afterwards, due to impacts on family that can then cause mental stress, anxiety, and so on. Another effect that we can see is that due to changed weather, we can see a change in factors, factors such as mosquitoes that carry diseases. So the areas in which mosquitoes that carry certain diseases such as malaria, dengue, and so on can live are expanding. So one example of that is that we've seen dengue cases in Europe that have never been there before. We've seen West Nile virus in areas that has never been seen before, but also in areas where those diseases are already present. For example, the impact of seasonality, which usually can cause that in some areas, for example, you have a couple of months where there's very heavy presence of malaria, can now expand across the whole year, where now people are facing the disease burden of malaria throughout the whole year rather than just a particular season. So that's another effect to mention is the effect through vector-borne diseases. And finally, and I think this is a really important one, especially talking and understanding the impact from the perspective of youth, is that climate change and the stress around it can cause stress and anxiety, which is often referred now to as, for example, climate anxiety, can cause that. And particularly in young people, we see big mental health impact of climate change and its expected effects due to the mental health stress that it causes. So yeah, I hope this gives you a bit of an idea of the multitude in ways in which climate change is connected to our health. And what I then want to mention, and here is an overview, by the way, on the slide, just so that there's a bit of an idea of what I just mentioned. So infectious diseases, that is, for example, the malaria, the dengue, diseases that can spread to places where they otherwise couldn't spread or can spread for a longer duration of time. Mortality, for example, due to extreme weather. We can see an increase in respiratory, cardiological, neurological problems, mental health, I mentioned. We also see more and more research that points towards, for example, heat negatively impacting pregnancy and childbirth. And this is also important to mention that this is particularly true in areas where people are not used to or able to deal with heat. So we see that climate change is creating increased heat, for example, in my country of the Netherlands, where because we have not been exposed to such heat in the past, there are very little measures in place to be able to deal with that heat. So that's another way of that. We've talked about food security. That's one point that I haven't mentioned yet, is that extreme weather or things like food security, droughts, and so on, can also impact people's movement, because it can make it such that people have to relocate to other areas where they do have access to food, they do have access to water, for example. And we know that there's a connection between relocation and movement of people and conflict as well. So that relationship is also there. We've talked about skin and allergies, which was also mentioned. Another one to mention is occupational health. There are many different occupations in which people are, for example, for longer times outside. If we're talking about agriculture, for example, who are now exposed to more extreme weather conditions. And that is one way in which occupational health is impacted. In this setting, I have to mention that those who are most acutely and in danger of the health impact of climate change are situated in low and middle income settings. And this is because of a variety of reasons. First of all, geographical. A lot of low and middle income countries are situated in geographic areas where more impacts are expected, more extreme weather, and so on. And this is in conjunction with the fact that these countries are more vulnerable to these effects and are less able to cope with the impact due to, for example, constrained resources. This is something that we have to recognize, particularly because historically, the major emitters and those contributing to greenhouse gases thereby creating climate change have, of course, been high-income countries. So there is this question of equity when we're talking about climate change and health. So before I no, let me move on for now. I think we'll have plenty of time for questions in the end. But if there's something that I'm going over too fast, please do use the chat function, for example, if you want to ask anything at this point in time that's relevant to your understanding of how I go. All right. So now we have outlined that there's a major impact of climate change on health through these direct and indirect effects that exist. So there are also another way in which we can look at this, because climate change can also challenge the capacity, the existing capacity of healthcare systems to deal with what they are facing now. We already know that there's a lot of health issues in the world, and we see a lot of issues within healthcare systems, such as an issue with healthcare workforce. In most countries, there is not enough access to enough healthcare workers. Therefore, we already see existing challenges with dealing with health impacts. The COVID-19 pandemic is another illustration of a challenging situation where the healthcare systems in many countries were stretched and in many countries went beyond their limits. And climate change, through its health impact, challenges this capacity further to deal with also existing health issues. So if you, for example, have an extreme weather event happening in some sort of situation, the healthcare system might be forced to deal with injury, trauma that is happening at that point in time urgently, which might reduce their capacity to deal with other types of health issues that are happening at the same time, or more chronic diseases of people that also require care. All right, so in addition to that, the impact of climate change on health and the healthcare system, we also know that the healthcare sector itself contributes significantly to the climate crisis as a source of greenhouse gas emissions. Healthcare systems must really seek towards systems that don't contribute to climate change, therefore, for example, are net zero, so that they don't contribute to this health emergency while they adapt and plan to cope with the health impact of climate change. That's kind of the situation that we're looking at here. So to dive a little bit deeper and give you a bit of an idea of what that looks like, of the impact of the healthcare system on greenhouse gas emissions, there's been a global assessment of the environmental footprint of healthcare systems, and it concluded that healthcare contributes to 4.4% of the global greenhouse gas emissions. And we also see that that has increased between 2000 and 2015, which was the latest global assessment, in 25%. So these emissions are rapidly increasing. Many health professionals believe it's very important to invest in healthcare to successfully manage the health effects of climate change, but often there's a lack of awareness or failure to consider that some certain actions in turn can initiate negative feedback cycles by increasing emissions. Luckily, awareness is growing, but we need to make sure that this is very much considered when we're talking about this context. And again, I have to mention here that there is a large variation across contexts when it comes to the footprint of healthcare systems. So in the US, for example, emissions of the healthcare system are around 8% of the national greenhouse gas emissions. In my own country of the Netherlands, this is around 7%. And comparing this to other sectors, like comparing this, for example, to the aviation sector pre-COVID, in the Netherlands, it was around 1 to 2% of emissions. So that the healthcare sector is 7% is definitely a situation that needs to be faced, as we, as healthcare providers, of course, want to contribute to health rather than do the opposite. In many middle-income countries, we see that the emissions are around 4%, and in low-income countries, this can be much lower. So this is something to definitely consider. And what I would like to highlight is that there are many examples in low and middle-income countries of excellent quality of care that are being provided at the fraction of resources that high-income countries use. So this is also an opportunity to get inspired by efforts that are happening in low and middle income countries within the healthcare system. And I would also say there's an opportunity here to advance the healthcare system while taking into account sustainability. And I think we have there a very strong health argument. And I also think we have a very strong financial argument to do that, but I'll come back to that in a bit. So I've talked a bit about the importance of considering both sides of adaptation and mitigation when we're talking about climate change and health. So there's a need for the healthcare system to be able to reduce its emissions as well as contribute to being able to deal with the health impact of climate change. So here are some examples of how you can consider both. And this is then specifically in the hospital setting. So at the top, we see when there's a co-benefit. So a co-benefit is when a plan, a policy, or a measure that aims to enhance an adaptation or mitigation objective leads simultaneously to the enhancement of the other. So one example of that is a hospital-wide passive heating and cooling system. So instead of it being active and therefore emitting more greenhouse gases, this one is a passive one. So the primary objective is mitigation. But of course, as we have already talked about, the impact of climate change, we also see that this can impact temperature. And so a passive system, a heating and cooling system, can provide a solution if you have not had any AC before within that situation. If we're talking about a synergy, that's a slightly different interlinkage. And this is an interaction between an adaptation and a mitigation plan, policy, strategy, or measure that produces an effect greater than if you would just have the components. So one very interesting one, and this one has been implemented, for example, in hospitals, in some hospitals in Indonesia, are green hospital rooftops. Green hospital rooftops means that they plant plants on the rooftops of the hospitals. They increase the energy efficiency of the hospital, and also in the case of extreme water rainfall, they decrease the runoff of the water and increase the ability to deal with that. And interestingly enough, these hospitals are now actually being converted into actual vegetable gardens. The vegetable gardens feed into the hospital by providing food directly to patients. And I find this a very fascinating approach, is that some patients within their recovery process are encouraged to work in the vegetable garden. Thereby it's contributing to their health, and there's now currently research going on to see whether this also contributes to their mental health as well as their physical. So that's a really interesting solution in which these synergies are fully considered. So what we're looking at now is we definitely have a gap in research, especially towards solution when we're thinking about climate change and health. I think there's a huge opportunity, which I've tried to highlight, talking about co-benefits. So how one intervention can contribute to the other, and also how, if we're looking at it more generally, how certain interventions contributing to mitigation or adaptation of climate change contribute also to health. And this is where it becomes the health argument becomes relevant to every other sector, is that in many sectors, you can easily make the argument that some certain measure not only contributes to mitigation / adaptation within that sector, but also contributes to health. There's current research ongoing, which will be published quite soon, hopefully within the next couple of months, which is a large commission that has looked at what in every single sector, what do we know about how climate action in that sector contributes to health. So that will be a very interesting research, which will strengthen our understanding as well of what these co-benefits are. But just to name some examples, if we're thinking about transportation, and we're thinking about the emissions of transportation, one good example of how we can reduce emissions of transportation is by more active transportation. So by encouraging people, for example, to take the bike. Taking a bike rather than a car, as you probably already guessed, definitely contributes to the health of that individual as well, reduces the chance of, for example, cardiovascular diseases. So this is one example in which action that is happening in a certain sector can contribute to the health of individuals. And therefore, also you can attach that financial argument here, because someone that is working on prevention of healthcare issues that they might face in the future would spend a lot less money treating those potential health issues in the future as well. Another example that we can mention is related to agriculture. If we're focusing, if we're trying to get, for example, local produce to be more attractive within the agriculture sector, this can also contribute to health in case that local produce is more fresh. There's more access to vegetables, for example. So these are some examples of how you can think about action in other sectors and use the health argument to make your case to do that. All right. So I wanted to share some financial arguments here as well. So these are some sources that I've presented to you here, but there are many more. And at the bottom, I have listed a website. So hopefully if you're wanting to dive more deeply into this, you can use your website to, you can use that website to get more ideas and more sources on the financial aspect of what we're talking about here. So I gave you some examples, but the examples that I'm sharing here on the slides are very much also connected to, for example, air pollution, which is another one that is that's another argument that you can easily use if you want to integrate the health nexus within climate action. So if we're looking at here on the right, this image shows that if you use clean transport and clean buildings and industry, specifically in the urban setting, this is what it can lead to. So it can lead to an aversion of hundreds of thousands, of around 100,000, well, depending on which action you do, deaths. And you also see at the bottom the economic impact that it can have. So this is done by C40 cities. So you can check that link also to see more details on that one. Then we have another source that shares us the following, that delivering the emission reductions set out in the NDC, these are nationally determined contributions. These are basically what every country has determined they will contribute to reaching the Paris Agreement and aiming to reach that 1.5 degrees Celsius maximum increase of temperature. If those are delivered in Europe, this would be equivalent to saving many, many billions, or 1 to 2% of the regional GDP, of which 34 billion is actually due to saved treatment costs. So here you see again the very strong part that health plays, and this is specifically tied to air pollution, this one, once again. So that doesn't even talk about all the direct and indirect health impact of climate change that we've talked about. That's not even calculated here yet, and you already see the very large number that is stated. So yeah, as I mentioned, these actions can directly lead to financial benefits. One example that I can give here, which is specifically in the healthcare setting, is that using certain solutions for example, energy, integrating renewables, or using specific more efficient equipment for cooling medication and so on, pays itself back very quickly. Especially in the healthcare setting, we see those examples, and reports are popping up more and more of this. So we're getting more and more data on this. But this is a very interesting one because, as I mentioned, since the healthcare sector is contributing so much to emissions, there is a need to rapidly transform. And we do see more and more reports coming out that those can also definitely have financial benefits, which is important if we want to do that transformation. And if that improves health and creates health benefits, we can see that in turn can create further financial benefits by reducing the need for healthcare and by preventing health issues amongst people. So let me talk a little bit about the current situation that we're in with regards to climate change and health. So as you're probably aware, the UNFCCC organizes a yearly high-level climate summit in which countries determine the way forward with regards to climate change. And this is following up on the Paris Agreement that was made in 2015. And in 2021, the COP26 took place, and this was held in Glasgow in the United Kingdom. And here the WHO initiated a new program, which is called the Health Commitments, where they asked countries to commit to creating healthcare systems that are both sustainable and resilient in the context of climate change, so are able to deal with the effects of climate change. We saw back then that 51 countries committed, of which it's important to mention around 75% were from low and middle income setting. Now we see that the number of commitments has gone up to 68. So the momentum is definitely growing, and very large countries such as the US and Brazil, with a large proportion of emissions as well, have joined those commitments. In 2022, the World Health Organization had its World Health Day, which takes place annually on the birthday of the WHO, which is the 7th of April. Coincidentally, also my birthday, but I don't know if that was meant to be or not. But last year's World Health Day was in the theme of the people, the health of the planet and the health of the people. So connecting that understanding that the health of our planet is very central to creating a healthy population. And the G7 also in its leader communique communicated that they committed to sustainable healthcare systems, and they called upon commitments to sustainable healthcare systems as well. So it's very much on the global agenda there. And the WHO has called after the pandemic for a healthy and sustainable recovery, once again underlining that relationship between climate change and health. Then the WHO has set up the Alliance for Transformative Action on Climate and Health. And here this followed these COP26 commitments that I mentioned, and it brings together all kinds of different actors, including countries, including private sector, including academia, including civil society, to think about how do we reach this commitment and how do we go forward. And COP27 took place last November in Egypt. What was interesting here is that there was a lot of momentum around health. I'm going maybe a bit too much into detail, but at COP27, they adopted a new area of work around loss and damage. And loss and damage is very much connected to, again, this notion of the large impact that climate change can have on health and the loss and the damage that it can cause. So again, health, we see is becoming more and more central on that global stage. And now we're looking at COP28, which will be taking place this coming November. And the presidency has recently announced that at COP28, there will be one thematic day specifically dedicated to health. So even though historically health was kind of left out of the picture, it's becoming more and more central, which in my opinion, is a good move because once again, I don't see health as something that stands on its own. I really see it as an opportunity for climate action in all different sectors and for solutions in all different sectors. So I just want to touch a bit upon, so why am I so engaged in the topic of youth, and why do I think youth voices are essential here? Is not only because this is our future and this is what we're looking at when we're thinking about climate change and health and all the impacts that we'll face in the future, also because young people have grown up in a very unique and different situation than the generations before them, have grown up in a world that's digitalizing, globalizing, more connected than ever, although not for everyone. We also have faced many conflicts in our lifetimes. And this makes it such that we're able to look at issues in a very different way than the generations before us. So I think there's a really important role for young people to play when it comes to solutions. And with that, of course, a really important role for those in leadership positions to play to ensure that youth voices are being heard. And I'm very excited about all the work that you're doing as well. And I just wanted to mention, that there's an important need to also make sure that this is highlighted in curricula, that there's an understanding of climate change and health, particularly, of course, amongst healthcare professionals, but also in other settings of those that can contribute to solutions. And we see a large role of young people within these UNFCCC COP spaces, making sure that there is awareness and building that awareness. And right now, the WHO Youth Council has chosen climate change as one of its priorities as well, which means that they want to push for this also within the World Health Organization. So if you're interested and you want to read a bit more on what WHO is doing right now when it comes to youth engagement, then I put the website for you there just as a reference. So that brings me actually at the end. So I'm glad that we still have time for questions. I would be happy to answer anything that I can. And here's, in case that you want to stay connected, some contact details. And once again, very grateful to be here with all of you. And I hope that you're having a wonderful, wonderful lab. Yeah, thank you.
Dr. Blom, I have a question for you.
Yeah.
Well, we're waiting for other people to, and I just want to make sure you can hear me.
I can. Yeah.
Okay, good. So one of my questions, in the early part of your presentation, you talked about mortality. You know, obviously climate change makes living conditions bad enough that people are dying ahead of time. And have there been any quantification of that? Meaning, you know, has anybody put together a figure that said, if we do nothing, if climate change continues down the path that it's going on, how many people would die from it? You know, what's the increased mortality on this planet if we don't do anything? Are there any guesstimates? Nobody's going to come up with an exact figure, but given certain assumptions, they might be able to come up with a figure. Is there anything like that?
Certainly, yeah, there is. So the World Health Organization itself has created a figure, and this is mortality only based on some impacts of climate change. So I don't have an overarching number, but that there will be one, I'm sure, shortly. But this is based on malnutrition, malaria, diarrhea, and heat stress, and how climate change is impacting those. Those four aspects already are expected to, between 2030 and 2050, cause approximately 250,000 extra deaths annually. So every year, and that is just these four effects. So it's most likely an underestimate of the overall impact of climate change on mortality.
Part of the reason for that question, or the follow-up question, you know, one is the priceless human life, but the other is the cost of that. I mean, the reason what I'm going after here is like a benchmark figure that one can justify spending X hundreds of millions of dollars on whatever, putting rooftop gardens on every hospital in the world or photovoltaic cells in the parking lot, whatever it might be. If you can say, look, it saves these many lives or saves this much money.
Yeah.
So is there similar numbers associated with the cost of unmitigated climate change? You know, if we do nothing, that's what I'm actually looking for. And then we've got a benchmark to use to justify large expenditures to make the world a better place. I mean, or at least dealing with climate change and its impact on health, for example.
Certainly. Yeah, certainly. Yeah, fully agree with that. And I think I also see a question of Carly in the chat, so I can touch upon that one, if that works. Carly is asking what kind or level of emissions has the healthcare sector had during the pandemic? An increase, the same, and how do you think this has impacted the sector's impact on climate change? So yeah, we have a couple of reports, but mostly from very contextual settings regarding emissions, or for example, regarding waste during the COVID-19 pandemic. And all of those reports that I have read within, you know, a local setting of a hospital, for example, show an increase of for example, waste, of electricity usage, of emissions. And so overall, I think in a way it's difficult to give an overall estimate. There hasn't been an overall measurement globally. And what I would expect is it to have impacted the sectors, to have increased the emissions of the sector. However, we have to see that within the context of there might have been decreases in other areas. So it's a bit, yeah, it's a really good question, I think, especially since we're expecting, you know, climate emergencies to happen in the future, and how would that impact the health sector's emissions as well. But there is no overall understanding of what it has done to the emissions, only this really contextual setting. So I hope that gives a bit of background. I cannot answer your question in full, but a bit of an idea on that one.
Another question from Edmund. You can read it or I can read it to you, whatever works. You know, on the cost benefits of healthcare and climate change, can you share some insights on how to measure the impacts with some metrics to make the case even stronger?
Yeah, certainly. So I think this is a really important question. And this is also within, for example, the COP space where I've been present. We're being asked this all the time. So give us the argument and how to actually measure this. I think it's a very important one. It really depends, of course, on the health co-benefit that we're talking about, how you measure that in particular. I'm also referring again to that report that isn't out yet, but will be out soon, because that will give a sort of an overarching idea of all the of all co-benefits, and you know how to measure and what is being measured right now and how that's being done. So yeah, I'll give you that again. Can't give you those details yet, but I'll give you a bit of a spoiler to keep an eye out for that one once it comes out. But as for metrics currently, what I would refer you to is, so I put on the slide the Global Climate and Health Alliance, and they have a webpage specifically dedicated to mitigation co-benefits. And here you can dive into some specific examples. So, you know, I showed on my slide the one with air pollution, and you can dive into that report and see the details of how they approach that. But also many other examples of where they've done that. So definitely, I hope that that's useful for you to dive deeper into that one.
So a couple other questions here. I will read the very next one that says, and the World Health Organization recognizes that there has been an increase in the frequency and severity of disaster events regarding climate change. Is there a plan to take action to mitigate the effects, or is that a different health global organization, or does WHO focus on research and awareness?
Yeah, so that's a great question. And the WHO definitely is focusing on how to mitigate the effects. So you will see that the WHO is very much present in these global climate spaces as well, to bring in that health angle for action. And within health systems themselves, they have now set up those commitments and the network that I talked about to mitigate these effects, which is also very central to those efforts. Interestingly enough, the WHO also has its own targets for net zero of the organization in 2030. So also even within the organization, there's this identified need to walk the talk, let's say. But definitely mitigation is in conjunction with adaptation very central to what the WHO is aiming to stimulate. Also using that health angle, certainly. Yeah.
Another question I've bumped into in the World Health Organization statistics, this is getting at the measurement issue that was asked earlier, something called dailies, or DAL. Can you explain that a little bit if you can? It's an interesting concept and way of measuring what health and health impact or lack of health care. I'm not sure all of its uses.
Certainly. No, thank you for asking that question. And it's a really important one because I think historically what we would focus on when we're thinking about health is a lot of the focus or the measurement would be around mortality. And DALYs and also QALYs, which is another one then, pushes us beyond just using the metric of mortality. So DALY stands for disability adjusted life years, and it's a way to measure certain impacts that have on people and how they live. So if you're living with certain disability as a result of a disease, that is what's being measured here. So it's not just the mortality, it's also the impact of the disease. And then there's another metric, which is quality adjusted life years. So that's another one there. And that one tries to assess the quality of life. So if you have certain disease that are impacting the quality of life, that is what you're measuring there. So it goes, it adds that other aspect to it. And maybe there's a global assessment of the burden of disease report. I will put the link in the chat, and they use these metrics as well. And they have a great website where you can use them and dive a bit deeper into them.
Thank you. One other question that somebody asked, can you share the slides with us? I think they were impressed with some of the data and everything else. And I think at least one of us, me, wants to follow up on some of the reports. We are making most of the reports that you all from the World Health Organization, as well as every other agency at the UN, the ones that are published in PDF form available to everybody in the lab for the research and development phase of what we're doing. But there might be key ones that I've missed that I'd like to go back and check. So that, if it's permissible, at your end, if it would be good to share that. And if there are any other questions, now is the time to ask them. Our next speaker is just walked into the room, and would like to thank you, Iris, for you're in Geneva, and it was not an insignificant sacrifice for you to be here, and we really appreciate it. Obviously, as well as what you had to say. It was really helpful, insightful, and it will be a big help. So thank you for everything you've done here, the presentation, but also for all your work. I mean, it's really incredibly important. So thank you for that. And I don't see any additional, or is there another? Yeah, no, that's it. The last question was, I think, sharing the slideshow, and you just left what is that link to?
Yeah,
That
that is
you
the
left?
global burden of disease study, so that can be used to have
Okay,
a bit more of an in-depth insight into that. Yeah, yeah, yeah.
thank you. All right. You are welcome to stay.